I'm Kevin Bolinskey. I teach objective personality assessment and the statistics courses that our graduate students take. My lab is the Mental Health Development Lab, and we do research in liability to serious mental illness, particularly schizophrenia, and personality assessment. Been pretty active in the past with research and hoping to get going again this semester, and with the MMPI 3 coming out in the last few weeks, there's going to be some opportunities for some research in the lab over the next few years, and that's probably what we're going to focus our areas of attention on.
My name is Tom Johnson, and I'm a professor of psychology here at Indiana State University. I teach graduate courses in cognitive behavior therapy, which is the first therapy course in our program sequence. I also teach a course in theories of addiction. I teach history of psychology, and I teach a fun course called Sex, Drugs, and Rock and Roll, which happens prior to COVID. It used to happen every other year in London, and I am offering a graduate section of that, assuming it gets offered in 2021. We shall see. The research that I have done here at ISU has been on a lot of different topics, but some of the themes that cut through those topics are that people seek structure and people seek meaning, often through goals in life, and people are social beings. Our social connections are very important to us. So I've studied college student drinking games. I've studied the role of religion and spirituality as a protective factor against addiction. Various other topics as well. The research that we're doing now focuses on two primary areas. One of the things we're starting to do a couple of studies on is looking at why people listen to sad music. What does that do for them? What do they think it does for them? What does it really do for them? Are there reasons why people in clinical populations should or should not do that? So we've got a lot of questions we're going after there. The other thing we've been looking at is substance use in the electronic dance music scene and how that's related to some of the sort of spiritual or positive psychology type experiences that people report from involvement in some of those types of social groups or music-based subcultures.
Hi, my name is Kathy Ocampo, and I'm the clinic director. So I am the director of the psychology clinic, which means I manage clinic operations, make sure we have a variety of clients available for our student clinicians. This is my 5th year here at the clinic and in the program. So prior to that, I worked in community mental health. So the courses that I teach for the program are the supervision and consultation class for 4th year students, the culture and diversity class for 3rd year students. I assist in teaching the 1st year seminar, and I've also taught various trauma courses for our summer courses. In addition, I am a clinical supervisor, and I have a practicum team that works with student clinicians who are working here in the clinic. And 2nd and 3rd year students see clients here in the clinic as part of practicum. I'm also chair of the Program Diversity Committee, and my interest areas are children, trauma, and diversity issues.
Hi, my name is Liz O'Loughlin. I'm a faculty member here in the psychology department at ISU. I'm also the director of training for the PsyD program. In my role as the director of training, I'm responsible for the day-to-day operations of the program, which includes things like oversight of curriculum, student evaluations, ensuring our compliance with our accreditation criteria. Pretty much anything that has to do with the program, I'm usually somehow involved in. I teach a 1st year seminar where we introduce students to the program and program requirements. We also cover introduction to ethics. I also teach a 4th year practicum where students complete their materials to apply for internship, as well as do case presentations based on their practicum placements. In between that, I supervise. I have a supervision team every semester, and I also supervise in the summer. I teach an elective in child psychotherapy, and I also teach an elective in projective assessment, which includes the Rorschach. My research interests broadly focus on evaluation of attention deficit hyperactivity disorder. I am the director for an ADHD evaluation clinic where mostly our second year students are involved in a practicum where they evaluate children ages 5 to 12. Some of the studies that we're doing right now, we have a study looking at emotional control or emotional regulation as a predictor of impairment over and above ADHD symptoms. Another study that is looking at help-seeking behavior. In other words, in terms of attributions for parents, how they attribute their child's behavior and how that may predict the type of service they may be interested in seeking after they get a diagnosis of ADHD. And associated with that is a study looking at compliance with the recommendations that we include in our ADHD evaluations. So that's a summary of what I do here at Indiana State University.
Hello, my name is Jennifer Schriver, and I have been a faculty member here at Indiana State University for about 20 years. My primary area of interest is in correctional psychology, so looking at issues that affect offenders. I'm also interested in forensic psychology, so looking at the evaluation of offenders, both pre-trial and then post-conviction. In terms of the research that's going on in my lab, we've got a variety of studies that are underway. Primarily what we're focused on are issues that affect offenders post-release from incarceration, so looking at the employability of offenders, both from an offender perspective in terms of how they go about trying to find employment, but also looking at employers, biases that they might have, and the strategies they use to determine employment for individuals. We're also looking at sort of criminal justice professionals and some of the factors associated with their behavior. So for example, we're looking at burnout in police officers and how that affects use of force. We've looked at the mental health training in both correctional officers and police officers and how that affects their later behavior. So looking at both offender issues and then also more systemic sort of professional issues in the field. So in terms of what I teach in the program, I teach a first-year course on advanced psychopathology, where we focus heavily on diagnosis skills and then also looking at sort of the structure and etiology and treatment of the major mental health disorders. I teach a seminar on correctional psychology, a seminar on forensic psychology, and then we're excited that next year I'll start teaching a seminar on group psychotherapy here in the program.
Hi, I'm Emily. I work with Student Services. I do the paperwork for you. I make sure everything runs smooth. If there's an issue, I troubleshoot it for you. I'm there for any questions you may possibly ever have, so come see me if you need to.
Hi, my name is Marty Branum. I'm the office manager or administrative assistant here at the psychology clinic. I've been here almost 5 years. So I work directly with the faculty practice plan, all the faculty members that do testing and therapy here at the clinic. I also work with the first and second year students who work in the clinic with me, scheduling and just taking care of our clients as they come in and answering calls. Thanks.